Good afternoon, everyone. This is Dr. Trinkatella, and welcome to the Great Plains webinar on the considerations in the treatment of acne and the causes, because oftentimes the treatment is related to the cause. So we're going to explore some of those issues right now and talk about some options for treatment, which is what I'm sure you're all mostly interested in learning about. All right, so this is just our basic overview today. So we're going to talk about how acne develops, some of the targets for treatment, some that you may be familiar with, and potentially some new options out there. Talking about also microbial imbalances of the skin, the importance of skin pH, the effect of hormones on our skin, things that we can address through diet and nutrition. And we'll talk about some nutritional supplements that are appropriate, also talking about digestive function and that relationship to what goes on with our skin. Also food allergies and sensitivities, which is an important topic when we're talking about inflammatory disorders. The relationship between stress and what appears on our skin. The use of topicals, both conventional and more alternative, and then some basic skincare recommendations. Okay, so I know that there's a lot of interest in this particular webinar because acne is pretty prevalent in the Western world. There's a global burden of disease that is about 9.4%. So this is a tough issue, and if you have dealt with it personally, or if you know of people who have dealt with it just beyond the typical acne of puberty, you know that it can be a very frustrating issue. So we know that there's a prevalence of acne vulgaris globally at about 680 million in 2016, and this was an increase of about 10% from 2006. So it seems to be increasing in prevalence despite the treatments that we do have available. Apart from the classic belief that acne results from sebaceous gland hyperplasia, abnormal follicular differentiation with increased keratinization, microbial hypercolonization of the follicular canal, increased inflammation is considered to be a primary initiator through activation of the adaptive immune system. So it used to be that we thought of acne as having an inflammatory component and a non-inflammatory presentation, but really what they're discovering now is that there is an issue of inflammation that initiates this process. And from a dermatological standpoint, those who specialize in dermatology in the conventional medical world, they're not really sure what initiates that inflammatory response. So we're going to touch on a few of those theories. Acne is a chronic inflammatory condition with a multifactorial pathogenesis. Hormonal changes during puberty can initiate acne, which is then further exacerbated by genetic and other factors. So we know that it can be initiated during puberty, but it can also go well into adulthood. It's a chronic disorder of the pilosebaceous unit of the skin. So this is where the action happens, in the pilosebaceous unit, where you get excess sebum production, for follicular hyperkeratinization and inflammation with the presence of C. acnes or Ketobacterium acnes. Now, the Ketobacterium acnes and Propionibacterium acnes, they're terms that are used interchangeably these days, because Propionibacterium acnes was renamed Ketobacterium acnes. So you may see that these terms or these names are used interchangeably throughout this presentation, but they are referring to the same bacteria. So acne vulgaris occurs in about 85% of adolescents around the world, with increasing frequency in adults and both male and female. So we're seeing it increase mostly within the adult population. It affects the skin with the highest concentration of sebaceous glands, which is on the face, chest, and back. And in some theories, it is really considered a disease of Western civilization. This was an observational study done back in 2002, so quite a while ago, but it still presents with the idea that what we do environmentally and the foods that we eat can potentially have an impact on the presentation of acne. And what this study did was they looked at different non-Westernized populations, a population in Papua New Guinea and a hunter-gatherer population in Paraguay, and noted that these populations of people really had virtually no acne, no skin disease resembling acne at all. And so they came to the conclusion that even though acne has some relationship to genetics, they felt that environmental factors and diet and lifestyle also play a key role in the presentation of this condition. So traditionally, acne was considered to have a non-inflammatory presentation where you had the comedonal acne, open comedones, closed comedones, and then it could advance to a more inflammatory disorder in which you would get the presentation of papules, pustules, nodules, and cysts. So this is like this increasingly inflammatory presentation with a worsening of the size and the just the angry looking nodules or cysts that can present when you have a lot of inflammation. But the latest research suggests that all acne lesions originate in an inflammatory process. So I think for us, from an alternative perspective, and where we are looking at different causes of inflammation, we can really get to the heart of those things by saying, okay, what are the things that contribute to inflammation? And we will get to that. So the key factors in the development of acne, well, inflammation. It's present early in the process of acne development, although it's not known exactly what triggers that inflammation. Changes in sebum can initiate pro-inflammatory lipids, which produces inflammatory mediators. Possible pH changes, microbial environment of the skin, these things could initiate changes in the sebum and promote inflammation. Hormones, of course, we know about hormones, and we'll talk a little bit about that. And also dietary factors can potentially change the pH of the skin, the microbial environment of the skin, the composition of the sebum of the skin, and all of these things may promote inflammation. It's sort of like when you think about what's going on in your digestive tract or anywhere else where we consider the microbiome and how it influences mediators of inflammation. So I think we're going to go back and forth relating what we're seeing on the skin to what can potentially occur in the digestive tract. We also see increased sebum production, and this can occur as a result of overactive signaling pathways within the sebocytes, which are the cells that produce the sebum, and it can be stimulated by androgens, can be stimulated by insulin and IGF-1. All right, so these are related to blood sugar pathways or the overconsumption of too many carbohydrates or sugar, which can increase insulin and IGF-1. IGF-1 can also be found in different animal-based foods that where you perhaps have used some bovine growth hormone. So these are all considerations in the development of acne. Activated pathways lead to lipid production, which accumulates in the sebocyte, where the sebum feeds on the bacteria, or the sebum feeds the bacteria, and it increases bacterial counts and promotes further inflammation. You also have the issue of follicular hyperkeratosis, and this can be promoted by androgen signaling and inflammatory mediators like interleukin-1A, where keratin will build up and the C. acnes will increase. So you have a increase in keratin production. And as the keratin increases, the sebum and the bacteria accumulate in that keratin and potentiate the inflammatory response. And then you have Ketobacterium acnes. This increases inflammation by activating innate immunity via toll-like receptors and inflammasomes. So these are parts of our immune system which stimulate inflammation. The Ketobacter acnes can secrete lipases, proteases, and other factors that promote tissue degradation and inflammation. So the presence of the bacteria, although it has a purpose and it's part of normal skin flora, like any bacteria, this particular one has the chance of being an opportunistic pathogen if it overgrows and if there's too much sebum feeding it. So it can promote this inflammatory process and a degradation of the tissue through the process of inflammation, where you're producing reactive oxygen species and you end up with just this chronic inflammatory condition. All right, so if we consider acne as an inflammatory disorder, what are the sources of inflammation in the skin? Well, the presence of C. acnes, which can trigger that innate immune reaction. And what that does is it further stimulates the release of cytokines and chemokines, and you have all of these inflammatory mediators that perpetuate the inflammatory process. You have the presence of sebum, which can increase by the stimulation of androgens or insulin-like growth factor, and it just basically existing in a pro-inflammatory state. So other systemic inflammation can certainly contribute to the increased production of sebum. And all of these factors can also influence a change in the composition of the sebum. And if you're changing the composition of that sebum through different fatty acids, it may perpetuate the growth of C. acnes. So you have the presence of cytokines, peptidases, defensins, and neuropeptides. All of these can get generated in the presence of inflammation and enhance that immune response, further contributing to the inflammation. So when I think of acne as an inflammatory disorder, I think from a naturopathic perspective, well, what are some of the things that we should look for that are potentially increasing systemic inflammation that may be manifesting as an inflammatory disorder of the skin? So one of the first things I think of is food allergies and sensitivities. I think of infections like H. pylori, which can occur in the stomach and has a strong association with acne rosacea. And other gut infections like parasites, bacteria, and yeast overgrowth. So thinking of what is going on in the gut that could be triggering an inflammatory reaction. I also consider a high glycemic diet, because if we know that insulin and insulin-like growth factor can bind to receptors in the sebocytes and increase sebum production, what are the things that increase insulin and IGF-1? Well, a high glycemic diet, lots of carbs and sugar. Exposure to toxins, heavy metals, and molds, that should all be looked at, because these are things that can potentiate inflammation, systemic inflammation. Imbalance in the fats that we're consuming. We tend to overconsume omega-6 fats because they're easier to get, and underconsume omega-3s, which have a more potent role in reducing inflammation. So making a concerted effort to increase our omega-3 fats can be helpful. And then the issue of leaky gut. Leaky gut, dysbiosis, these things can be related to what's going on in the gut. It could be related to infections. It could be related to just bacterial overgrowth. Somebody may have SIBO. Somebody may have maldigestion and malabsorption, which can contribute to the development of leaky gut and dysbiosis. Metabolic disorders, you know, where people have PCOS, women can have PCOS, and we know that that is strongly linked to the development of acne because of the excess of androgens. But from a male perspective too, men can develop metabolic disorders by overconsumption of carbohydrates. And you get a dysregulation in blood sugar control, an increase in insulin, and you basically exist in a state of inflammation because it dysregulates the immune response. And you have this low level of inflammation. And that's also associated with dysregulated inflammatory responses and the presence of lipopolysaccharides. And that can come from leaky gut. So if people have dysbiosis or bacterial overgrowth in their gut, they can end up getting systemic absorption of endotoxins, which puts them in a state of this low-level chronic inflammation. All right, so let's talk more about sebum production, because this is often a target for treatment in conventional medicine. So the sebaceous gland and the hair follicle together form the pilosebaceous unit. Sebum is a mixture of lipids composed mainly of triglycerides, wax esters, squalene, free fatty acids, and smaller amounts of cholesterol and cholesterol esters and diglycerides. IGF-1 and androgens promote the proliferation of sebocytes and production of sebum in the sebaceous gland. So we have receptors for IGF-1 and for the androgens. And this is why when kids are going through puberty and their hormones are increasing, those receptors in their skin, on their face, chest, and back can become activated, and all that sebum production increases as they're going through puberty. 5-alpha reductase, which is an enzyme in the sebaceous glands, can convert androgens into DHT. So it basically takes testosterone and converts it into its most potent form. And that can also increase sebum production. And our genetics can certainly determine the number of androgen receptors in our skin, but not only the number of androgen receptors, but the sensitivity of those receptors to the presence of androgens. So as a woman, you may not have high testosterone levels, but the receptors in your skin may be very sensitive to the presence of those androgens. So with follicular hyperkeratosis, this is another means by which acne can develop. Hyperkeratosis is the abnormal and rapid shedding of skin cells into the sebaceous gland and the hair follicle. Hyperproliferation of keratinocytes and reduced separation of corneocytes, which is basically the outermost layer of the epidermis, leads to clumping of the cells in the follicle. So you just basically get a clogging of the pore. And because people are not shedding the outer layer of the skin as effectively as they should, you're getting these cells that are dumping into the follicle, and you don't have a way for them to get out of the follicle. So that creates an accumulation of cells and accumulation of bacteria. Keratin and sebum produces a thick and cohesive conglomeration that does not easily move out of the follicle, providing an environment for bacteria to proliferate. This hyperproliferation of keratinocytes and reduced separation of the corneocytes results in the formation of a microcomedone. So IGF-1 and androgens promote the proliferation of keratinocytes as well, and the production of keratin. So they increase sebum and they increase keratinocytes. And this is just a diagram showing you. So the very top of the screen is the stratum corneum, and this is where the corneocytes are. So what can happen is that you get a decreased exfoliation of the stratum corneum, and as those keratinocytes are pushing their way up to the top, they have really nowhere to go, nowhere to slough off. So there's an accumulation of the keratinocytes, which is why some of the treatments, a lot of the topical treatments, try to break down the adhesion between those cells so that that skin can slough off, so the pores don't get clogged. All right, and then the subject of Ketobacterium acne. So this is mostly a commensal bacteria. It's a normal bacteria that is found on your skin. It's found predominantly in the pilosebaceous follicle. It regulates skin homeostasis, maintains barrier function, and prevents colonization of other organisms. So it's supposed to be there. It's like a lot of the bacteria that we find in our gut. They're supposed to be there in a small amount, but if they overgrow, that's where they cause problems. And it's usually the environment of the gut that allows for a normal commensal bacteria to become an opportunistic pathogen. And the same thing can happen with the skin. So, you know, it's a ubiquitous gram-positive anaerobic bacterium that resides deep within the sebaceous follicle. So it's not right on the surface of the skin, it's deep within the follicle. And skin with acne does not necessarily harbor more C. acnes than skin without acne, but it may have a higher ratio of a particular phylotype that is associated with acne. So there's 3 distinct subspecies of C. acnes, and phylotype 1A1 is most abundant in acne sufferers. So quantitatively, people with acne don't have more of the overall bacteria, they just have a higher ratio of phylotype 1A1. Phylotype 1A2 seems to be very resistant to clindamycin. So for people out there who have tried using topical clindamycin and it hasn't done anything, they may have a higher abundance of this particular phylotype. Host and environmental factors activate innate immunity and enhance inflammatory reaction to the bacteria, determining the severity of the acne. So when we talk about the host and the environmental factors and how we activate that innate immunity, it's what's going on inside of our bodies in terms of inflammation and perhaps the environment on the skin, which we'll get a little bit more into later. Each follicle may contain different ratios of C. acnes subspecies, which makes it difficult to treat, which is why some people respond to a particular topical therapy while other people don't respond at all. And this is probably why there's so many different formulations out there that people try, and they work for some and then they don't work for others. All right, C. acnes can also form a biofilm, which protects the bacterial colonies from a harsh environment. So, you know, this is part of our normal flora, and our skin forms what is called an acid mantle to protect our skin. And C. acnes is part of that. It's part of creating that microbial balance on the skin. When we use products like salicylic acid, what that does is it helps to break down that biofilm so that if you're using any kind of antimicrobial product, you've basically opened it up a little bit so that antimicrobial can work better. Antibiotic resistance is an issue with overuse. I think we all know that. That's a big issue these days. You know, we can develop resistance in our gut, we can develop resistance within our body to certain antimicrobials, and we can also develop resistance with the bacteria on our skin. And so things may work for a while and then not have any effect later. Antibiotics also modify the skin microbiome, allowing for resistant bacterial species to emerge. So it's just like the gut. I mean, let's think about what goes on in our digestive tract and systemically when we take an antibiotic. The same is true when we're using antibiotics on our skin. So avoiding the excessive use of topical and oral antibiotics as monotherapy can reduce these microbial imbalances. Use of benzoyl peroxide and retinoids in a conventional medical setting would be more appropriate for long-term treatment. So what a lot of dermatologists are doing out there is I think they're trying to move away from the use of too many topical antimicrobials and manage things from the perspective of, you know, reducing sebum production and reducing overproduction of keratin and encouraging the skin to slough off those dead cells so that a comedone does not form. All right, so let's just talk about targets for treatment. So it's all the things that I've talked about briefly, and a few other things which I'll mention that are kind of new to the world of addressing acne. So when it comes to inflammation, I am a fan of using topical anti-inflammatories because if inflammation is the source of the problem, if it's there at the beginning and all the way through, if we can reduce inflammation at the surface of the skin, then I think that is a positive effect. And whether it comes from a topical or whether it's something that we're doing internally and reducing systemic inflammation, it can certainly be a benefit. Sebum production, reduce the triggers for excess sebum production and accumulation. So considering androgens, and we'll talk about some new medications that are coming around next year that might be effective in that regard. And then dealing with insulin. I think it's a little easier to deal with insulin and IGF-1 because these can be modified by our diet, so we have some control over that. The androgen issue and the sensitivity to androgens is something we may not have control over, but we certainly have control over our diet and the amount of carbs and sugars that we consume. Follicular hyperkeratosis, there's a lot of topicals to decrease keratin accumulation. That's where the retinoids come in. C. acnes bacteria, decrease conditions that allow for C. acnes to proliferate. So we're not necessarily going in and trying a lot of antibacterials because it's the host environment that allows for the bacteria potentially to overgrow within the pilosebaceous unit. So considering the skin microbiome, the pH of the skin, and overall sebum production. So instead of having to use an antimicrobial, we can control the host environment a little bit more. So we want to think about things like skin pH. Normal pH supports healthy bacteria and a healthy and sufficient acid mantle, which is basically what protects our skin from the environment. And our face has to have a very good acid mantle because it's constantly exposed. It's not like the rest of our body where it may be covered up for certain parts of the year. Our face is always exposed, so it has to have a healthy acid mantle to protect us from environmental factors. Looking at our skin microbiome, the use of bacteria to support the skin microbiome, both topically and internally. This can inhibit the overgrowth of opportunistic bacteria and support the acid mantle. So when it comes to supporting pH and the microbiome, these two factors are related because the skin pH supports a certain microbiome, and the microbiome also enforces a healthy skin pH. The issue with hormones, that is a huge topic in and of itself. I'll touch on it briefly, but then I'm going to direct you probably to another lecture that I did for Great Plains a while back to get a little bit more into that subject matter. But when it comes to hormones, correcting the underlying hormonal imbalances and supporting hormonal clearance, there's a lot that we can do there. And I'll talk about some of the underlying factors that can contribute to hormone imbalances. And then dealing with androgen receptors. There's some new medications coming around in 2021 that has a new mechanism of action, and it's a new mechanism of action, the first one in 40 years when it comes to treating acne, and it's a topical product, which I think is great because systemic anti-androgens, are only appropriate for women, and even then I question really how good they are. All right, so in addressing microbial imbalances of the skin, I'm just going to read you this quote because I think it's very poignant to the topic of thinking about the skin as having its own microbiome. While the commensal bacterium, Propionibacterium acnes, is involved in the maintenance of a healthy skin, it can also act as an opportunistic pathogen in acne vulgaris. The latest findings on P. acnes shed light on the critical role of a tight equilibrium between members of its phylotypes and within the skin microbiota in the development of this skin disease. Indeed, contrary to what was previously thought, proliferation of P. acnes is not the trigger of acne, as patients with acne do not harbor more P. acnes in follicles than normal individuals. Instead, the loss of the skin microbial diversity, together with the activation of the innate immunity, might lead to this chronic inflammatory condition. So I chose this quote because I think it really highlights what I'm trying to focus on here, is that we have bacteria on our skin. We're supposed to. We have bacteria in our guts and throughout our body. We're supposed to. It's trying to create the environment that allows for balance of that bacteria. And that's where pH and microbial diversity of the skin and reducing inflammation come to play. All right, so let's talk a little bit about the skin microbiome. Bacteria on the skin comprises the microbiome of the skin. One of the important roles of beneficial skin microflora is to promote homeostasis by influencing inflammation and immune cells. So just like what happens in our gut. A healthy skin microbiome supports skin barrier function and inhibits opportunistic and pathogenic bacterial growth. So having a good, healthy skin microbiome could inhibit the overgrowth or the imbalance of C. acnes. A robust native skin microflora results in a protective environment that limits the ability of pathogenic bacteria to initiate and propagate an opportunistic infection. Removing too much bacteria may result in a disrupted skin microbiome, allowing for more pathogenic bacteria to grow. And so I think too, this is why perhaps using topical antimicrobials only works for a short period of time. It may work initially, But then the microbiome of the skin has to grow back in some way, and if it comes back in an imbalanced state, you're back where you started. Oral probiotics can create balance within the digestive tract and reduce gut inflammation, thereby regulating the innate and adaptive immune system. So we know that a good bit of our immune system resides in our digestive tract, and that the microbiome has a great influence over how that immune system functions. Loss of microbial diversity can lead to chronic inflammatory skin diseases, and this can be related to the microbiome on the skin and in the gut. Microbial diversity of the skin is associated with the environment of the skin. So overuse of antimicrobials can reduce diversity and allow for more virulent bacteria to grow. Hydration, blood flow, weather, gut function, diet, skin pH, and sun exposure all affect the skin environment. You know, a lot of people feel like their skin gets better if they have acne, if they expose it to the sun, and it's kind of dose dependent. So a little bit of sun exposure on the skin is good, but too much is bad because it can change the microbial balance of the skin. And if you get sunburn, you can increase sebum production, which can ultimately make the acne worse. The microbial environment of the gut can impact the skin. Skin is often referred to as the external reflection of what is happening in the GI tract. If the gut is inflamed, the skin may also be inflamed. There's often an association between eczema and what is going on in the gut, eczema and food allergies, eczema and other kinds of food sensitivities or gluten sensitivity. So we know that what is going on can manifest on the skin. Normal skin flora contributes to a healthy acid mantle and production of ceramides. Ceramides are basically lipids that protect the skin. They're part of that acid mantle, and they form the skin barrier. They protect us from the environment. They help to hydrate and nourish the skin as well. So metabolites of ceramides. So there are enzymes in the skin that will break down these ceramides into metabolites, and they have antibacterial and anti-inflammatory properties. So they operate to help sustain that microbial balance in the skin and to reduce inflammation. So how do we support a healthy skin microbiome? So for people out there who are using a lot of antimicrobials, a lot of topical antimicrobials, trying to decrease the use of these antibacterials and try to restore a healthy skin microbiome. And to do that, one of the things we have to do is support a healthy skin pH by using gentle cleansers with an appropriate pH. Normal skin pH is anywhere between 4.7 and 5.5. And using a lot of harsh soaps, soap tends to have a very high pH. It tends to be much more alkaline. So when we use like bar soap, something that lathers up a lot, that tends to be more alkaline in nature. And if you're using that directly on your face because you want to have that squeaky clean feeling, you're really stripping off the acid mantle of the skin, and the skin is losing its healthy pH. And it will eventually get it back, but if you're constantly doing that, if you're constantly stripping off that acid mantle, the skin has to try and restore that, and it may have difficulty doing that. Taking oral probiotics like Lactobacilli and Bifidobacteria strains can help to decrease systemic inflammation. The use of topical probiotics. So this is a new area in skincare, is the use of topical probiotics. And so there's not a lot of research out there at this point, but there are some companies out there making topical probiotics in creams and sprays. And I think they're worth a try because particularly if they're in a spray, what you're trying to do with these topical probiotics is you're trying to introduce some microbial diversity to your skin, and you're also trying to use those microbes to sustain a healthy pH. And I'm going to give you some examples of some products that are out there. You also want to remove sources of inflammation. So from an internal perspective, consider food allergies and sensitivities, infections, leaky gut, gluten, toxins, and heavy metals. And these are all things that you'd have to screen for with some testing. When it comes to external sources of inflammation, over drying, using harsh chemicals or harsh soaps on your face is not really good, because your skin will respond by increasing sebum production to try and balance that out and restore its normal pH. Certain cosmetics, and then bacteria on the skin. So you want to support that skin barrier and that acid mantle and keep your skin protected and well hydrated with a healthy lipid layer, because that's what protects your skin, and your skin will always try to get back to that, to what is normal. And in the process of trying to get back to that, if your skin is imbalanced in some way where you have increased keratin or increased sebum production, in its effort to get back to making that healthy skin barrier, it could be increasing the production of keratin or increasing the production of sebum, and also increasing acne. So here is a product. This is a topical probiotic. So I'm going to talk about 3 different topical probiotics, and I chose ones that basically come in a spray. Because, when people have serious acne, they have to be careful about the types of emollients that they put on their skin. And so with this, it's just a spray. It doesn't add to the oil of your skin. And this one is by Mary Ruth's. It's got a couple of the bacteria that are healthy for the skin, Lactobacillus acidophilus, Plantarum rhamnosus, Salivarius and Lactis, and some Bifidobacterium bifidum. So these are acid-forming bacteria, and so that's the thing that I think we need to emphasize, is that a lot of healthy bacteria tend to reduce the pH on the skin. And so if somebody is having issues with maintaining a healthy pH of like 4.7 to 5.5, using topical probiotics may help to normalize the pH so that the skin isn't always struggling to get back to that. This is another one. You can see what the products are in there, which of the bacteria are contained in this product. Again, it is a spray, and it can be used for things other than acne too, eczema, rosacea, psoriasis, anything where you've got an inflammatory reaction in the skin. And this one is Mother Dirt. You may have heard of this one. It's gaining some popularity out there. This is basically a live cultured ammonia oxidizing bacteria. So it takes ammonia in the skin and in the sweat, and it metabolizes it down to help support a healthy pH and decrease inflammation in the skin. So again, this can be used directly on your face and all over your body. All right, so with the use of oral probiotics, so we talked about the topicals, and now we also want to introduce good oral probiotics. So we know that oral probiotics can counter pathogenic bacteria and support barrier function and contribute to the regulation of the innate and adaptive immune responses, because our gut is a major source of our immune system, and it is regulated by the presence of these bacteria. The microbial environment in our gut and skin can influence the expression of our genes that ultimately determines if a disease develops and what the severity of that disease might be. Probiotics modulate gene expression within the immune system. The largest reservoir of commensal bacteria resides in our gut and acts as the body's largest immune organ. Probiotics can exert their influence on immune regulation with effects extending to other organ systems like the skin. Imbalanced gut microbiota can contribute to chronic inflammation throughout the entire body. Relationship between endotoxin and insulin resistance, elevated IGF-1 and acne. So when I talk about endotoxin and its relationship to leaky gut and insulin resistance, what we find is that people who have absorb endotoxin, it can dysregulate glucose regulation in the body, and you get an increase in insulin resistance and elevated IGF-1 levels, and all of these things can affect sebum production and keratin production. Probiotics improve insulin sensitivity, regulate the release of inflammatory cytokines in the skin via the gut-associated lymphoid tissue, protect skin barrier via improved skin hydration, increased production of ceramides. So those are the things that we like to have because they protect that skin barrier, and healthy fats in the skin. They inhibit C. acnes via the production of antibacterial proteins. Both oral and topical have the benefit of that. And there are certain species that are associated with decreasing inflammation, particularly related to acne. So the Lactobacillus species, reuteri, paracasei, and casei, all of these have been associated, and there were some studies showing that there was decreased inflammation when it came to acne in the use of these types of oral probiotics. And here's a few products that contain some of the targeted bacteria that have shown to be beneficial. This is a product from New Beginnings Nutritional Probio 100, mostly Lactobacillus and Bifidobacter species, which are the ones that are most strongly associated with having benefit with acne. So this is a good product. Also, Lactoprime Plus has a good combination of Lactobacillus and Bifidobacterium species, and also Probiotic, which has Bacillus coagulans, which has also been associated with reducing inflammation in acne. And all of these products are available through New Beginnings Nutritionals. All right, so skin pH, I think, is another important topic to discuss here because you know, we've heard about like the, pH controlled products out there. And so what does that really mean? What is the normal pH of the skin? So normal pH of the skin can range anywhere from 4.5 to 5.5 for women and from 4 to 5.5 for men. And so skin pH below 5 tends to be healthier. It's more hydrated and it has better barrier function. So this acid-alkaline ratio, it ranges from 0 to 14, with 7 being neutral. So the skin is slightly acidic. So when we think of the fact that it is slightly acidic, and the presence of those healthy bacteria, they're acid-forming bacteria, so they contribute to supporting the pH, and maintaining that pH also supports the presence of those bacteria. So why is the pH important? It maintains skin barrier integrity, the acid mantle that protects from bacteria, fungi, viruses, and pollutants. All right, so that should say a lot, that this barrier on our skin is referred to as an acid mantle, meaning that it is acidic in nature. The pH, having a healthy pH, helps to maintain the adherence of healthy bacteria to the skin. It supports an environment that creates a healthy skin microbiome. Products should have a pH between 4 to 6. Use of non-soap cleansers that are mild to avoid the stripping of the acid mantle helps to maintain a correct pH. So it's hard to know whatever products that you have. If it doesn't tell you what the pH is, you might have to do a little sleuthing and figure that out yourself. You can get pH strips at any pharmacy, and you can kind of get it's not spot on accurate, but you can tell by the color if it's within a certain range of pH to know if the products that you're using are somewhere between a 4 and a 6 on the pH scale. And this website that I've listed here, skincareph.com, they go through and list the pH of a bunch of popular products out there, things that you mostly would buy at the drugstore or online, just to give you a sense of which products are in a healthy pH range. So as I said before, bar soap tends to be very alkaline. It ranges on the scale of like 9 to 14. So using bar soap on your face or even on your body is really not that healthy, because you're basically stripping down the pH and affecting the microbiome on your skin. So when it comes to the rest of your body, the advice has always been not to soap up your whole body unless you're using something that's pH balanced, and to only wash the body folds. You don't need to lather up your whole body every single day, because you're basically stripping away your microbiome, and your microbiome is part of what protects your skin. Okay, so the issue with pH is that there was a study done on skin surface pH in acne vulgaris. This was an observational study, and basically the conclusion stated that Increased facial skin pH in patients with acne at basal conditions mirrors a chronic state of stratum corneum instability, which could be predisposing individuals to acne occurrence and/or recurrences. It could possibly be a common domain via which the classical pathomechanisms might be acting in acne. So they're basically saying that if you have an elevated pH on your skin, people with an elevated pH of 6 or above had a higher predisposition to acne. So addressing the pH is important because it's a predisposing factor that adds to the development and recurrence of acne. All right, so let's talk a little more about skin pH. A shift in pH to a more alkaline level predisposes the skin to several inflammatory conditions, including acne. A rising pH results in more C. acnes. So they found that a pH of about 6 to 6.5 increased the growth of C. acnes, while decreasing the pH to about 4.7 to 5.5 decreases the growth. So that's an important thing to keep in mind. It's the environmental factor, it's the host factor that allows for that creates the condition where acne can develop. Epidermal keratinization utilizes enzymes that are pH dependent. An increase in pH triggers desquamation and epidermal hyperproliferation, leading to follicular hyperkeratinization. So the breakdown of the keratin so that your body can push it out and get rid of it as it produces it, is dependent on enzymes that are dependent on a pH, on a more acidic pH. And if the pH gets too high, those enzymes don't work and that keratin can accumulate. Androgens, particularly testosterone, slows down barrier recovery through various mechanisms which can influence the skin pH. So the presence of androgens in the skin can have an effect on pH as well. Estrogen tends to increase the acidity of the skin barrier and improves barrier recovery overall. Skin pH is affected by the microbial environment as well as influencing the microbial environment. Again, so pH and the microbial environment are interrelated. All right, so factors influencing skin pH. So factors that are non-modifiable or endogenous are ethnicity, age, sex, and anatomic site. So our skin pH differs in different areas of our body for differing reasons. As I was saying before, your face is constantly exposed, so it has to have an acid mantle to protect it. So it's going to be more acidic than perhaps other areas of your body. Hormones and genetics represent endogenous factors that can influence pH. The pH of the skin differs at different sites on the body and tends to go up as we age. So that's kind of an interesting thing to think about, that the pH can go up as we age, and that can influence the aging of the skin. Modifiable and exogenous factors are obviously the cleansers that we use, the topicals that we use on our skin. If we sweat a lot and don't clear that sweat off of our body, sweat can tend to be more alkaline. The sebum, the accumulation of sebum, our diet, and the microbial environment on our skin. So cleansers that are alkaline, that contain surfactants like sodium lauryl sulfate, which is very common. It helps products to foam up and bubble. And we like that because we think that we're getting soapy and that we're getting clean because we have a product that's bubbling. But that's usually due to the presence of sodium lauryl sulfate. It makes that bubbling action. It's also in toothpaste. Excessive sweating. Sweat has a pH of approximately like 6.3. I'm sure it varies from person to person, but it tends to be more alkaline than your skin wants to be. And that's the use of Mother Dirt product. So what they're doing, I mean, we're sweating all the time. I mean, we always produce a little bit of sweat on the skin, and we are missing that bacteria that takes that alkaline sweat and metabolizes it. It's something that because we're so clean and we're not out in the environment as much as we were in the past, we're missing this particular bacteria that converts our sweat into something that's less alkaline. Vitamin A and monounsaturated fats tend to lower our skin pH. So there was somebody who had submitted some questions several weeks ago, and I'll address the issue of vitamin A at the end of the lecture to talk about the effects of vitamin A on the skin. The use of topical and oral probiotics can influence the pH, which we touched on. So acid mantle and skin barrier. Alterations in skin barrier function and integrity have been reported in those with acne vulgaris. And when we talk about alterations of skin barrier and function, we're talking about pH in the presence of healthy bacteria. It's unclear as to whether this alteration is a result of acne or a predisposition to this inflammatory process. So it's hard to know if what's cause and effect here. But I think what we know, we should work with what we know is healthy and try and get back to that state and see if it has an effect on acne and the inflammatory process. The stratum corneum pH represents many functions of this layer of the skin and its role in barrier function. So the pH of the surface of the skin affects many different layers of the skin. The pH of the acid mantle is derived mainly from the production of lactic acid bacteria, free fatty acids, and phospholipids on the surface of the skin. So we want to help to maintain that acid mantle and that pH. The pH is a parameter that cumulatively represents the functioning of various units within the skin, including the stratum corneum. So if we were to measure the pH on the surface of our skin, which, you know, there's meters and ways of doing that. I don't know if you could really do it with a pH strip, but if you were to measure the pH on the surface of the skin, it's also going to represent what's happening at deeper levels. The pH of the stratum corneum is analogous to that of the pilosebaceous unit. So we know that the surface pH is representative of the pilosebaceous unit where acne can form. All right, so hormones are a big issue when it comes to acne. We all know that, you know, we can develop acne going through puberty because of the increase in steroid hormones, particularly testosterone. And for many kids, this is a transient thing. Once those hormones level out, you know, their skin clears up and they move on. But for a number of people, it never really goes away and it follows them into adulthood, and it can become a source of frustration for a lot of people. So when it comes to hormones, we know that androgens, testosterone, DHEA, DHT, the more potent testosterone, can increase the size and number of sebaceous glands and sebum secretion. So you've got more sebaceous glands and more sebum production. Estrogen can reduce the size and number of sebaceous glands and sebum secretion. With puberty, rising hormones and androgens, and an immature hypothalamic pituitary gonadal axis, where you may get surges of hormones as your body's trying to figure out how to make its entrance into adulthood from a hormonal standpoint. So things can be a little bit unstable until this levels out as kids get older. The use of oral contraceptives, sometimes they're used to prevent acne because they suppress hormones and they suppress androgens, but you have to choose the right ones. Progestins, which are synthetic progesterone, is a precursor to testosterone. So if you use the wrong oral contraceptive, it could make acne worse. So usually it's the progestins from those first and second generation oral contraceptives. Most docs who are using these oral contraceptives or prescribing them know which ones are going to be appropriate for acne. It's not my favorite way to treat acne, you know, so I think there's definitely other things that we can do. We'll talk about that later as well. The issue of PCOS, that's very big for women. It's a very common disorder these days. It has a strong connection to glucose dysregulation and insulin resistance. It can result in high testosterone, low sex hormone binding globulin, irregular menses, and anovulation. So overall, just hormonal imbalances. And due to the fact that women aren't ovulating regularly, there's constant stimulation on the follicles within the ovary to try to mature so that she can ovulate. And that stimulation on those follicles can increase the output of testosterone. And you know, oftentimes it's also associated with insulin resistance. So high levels of insulin can lower a protein produced in the liver called sex hormone binding globulin, which has a very strong affinity for testosterone. And so if you have high insulin, it will tend to lower sex hormone binding globulin, which leaves a lot of that testosterone to be free testosterone and bind to receptors and have an androgenic effect. So if you don't have enough of that sex hormone binding globulin around, you have more active testosterone. It doesn't mean that your testosterone is quantitatively high, but it's what you do have is more active, and that could be problematic. Cushing's syndrome or congenital adrenal hyperplasia, these are more serious conditions. Congenital adrenal hyperplasia is a genetic disorder. It can present as classic and non-classic. Usually, if somebody has the classic presentation, they're going to know very early in life if they have this disorder, and they're likely going to have it addressed. Oftentimes with the non-classic, women can present later in life that they have this disorder where they have an enzyme deficiency, and it results in high levels of androgens. And so that can certainly contribute to acne. Cushing's syndrome also results in a high level of androgens, and that can also result in acne as well. Irregular menses, this can happen early on when a young girl is starting to, she's just entered menarche, and her body is trying to figure out how to make this new communication between the hypothalamus and the pituitary and the ovary work smoothly. And it may have some stops and starts until it matures, and so you may get some surges in hormones until that levels out. Issues with low body fat, thyroid issues, all of these can just result in low sex hormone output, a lack of ovulation, or irregular menses. So those things have to be looked into. When evaluating the endocrine system, you want to look at thyroid, you want to look at adrenal, you want to look at ovarian hormones, and you want to see where the problem potentially lies so that you treat it appropriately. Issues with amenorrhea, this can happen because of low body fat or athletics. Girls who are training a lot, do a lot of endurance sports, have very low body fat. They can stop menstruating because their body's, stressed. It's going through a certain level of stress that basically says to them, well, it's not appropriate for you to reproduce right now, so you're not going to have periods anymore because it's not appropriate you don't have enough to support a growing child. So that's basically what the body is saying. This can occur through HPO axis dysfunction. It can occur under stress. It can occur because of thyroid issues. So again, you have to do a complete evaluation. Thyroid disorders, hypothyroidism, which could be triggered by autoimmune problems, gluten sensitivity, goitrogenic foods, and the thyroid just has a general influence on gonadotropin output. So again, evaluate the whole system. Look at the adrenals too. Stress has a major influence on acne, and so it's important to look at these. Elevated cortisol can increase sebum production. So when, college students tell you that their acne got worse during finals, well, that's probably why, because their increased output of cortisol increased sebum production, and that is a precursor to acne. And then there's genetics. The one thing that we can't control, but we do have control over epigenetic factors, so not all is lost. But if you do have a parent that has had acne, you have a increased chance of a child having acne. And the possibility of that may have to just do with increased androgen receptors in the skin. And it may not be related to high androgen levels at all, it's just a sensitivity in the skin. So if you want to look a little bit deeper into hormones, I recommend that you go and listen to the strategies for balancing female hormones. It's in the GPL archives for their webinars, and that'll give you a little bit more information about how to evaluate hormones. So when it comes to genetics, there's some studies looking at these, and there was a large study out of the UK on 400 twins, which showed that 81% of acne was due to genetic factors. Those who have a first-degree relative with acne will have a 4-time higher increased risk of developing acne. This is particularly true with post-adolescent acne. I mean, in young kids going through puberty, we kind of know why they get acne, because their body's trying to work out these hormones and they're surging, and you know, there's a lot for it to, it's just got to settle down a little bit. But if acne continues into adulthood, there's likely going to be a stronger genetic component there. The genetic susceptibility to acne results in part from variations in the structure and maintenance of the pilosebaceous unit that creates a follicular environment prone to bacterial colonization and resulting inflammation. So any one of those factors, it could be sebum production, hyperkeratinization, that leads to an increased colonization of the bacteria, which contributes to increased acne formation. Genetic variations have an influence on accumulation of dead skin cells, sebum production, the number of androgen receptors in the skin, and that increased inflammatory response to acne, or C. acne. So it may not only have to do with these other factors here, but you may be more prone to having an increased inflammatory reaction to this particular bacteria. And so it makes it a lot worse for you genetically. All right, so let's talk about diet and nutrition and some of the dietary factors that can potentially contribute to acne. And I'm sure you've already figured out by now that a high glycemic diet, which results in increased insulin production and IGF-1, can stimulate sebum production and promote inflammation in the skin. Excess dairy consumption, you know, there's studies out there that say, yes, there's a relationship. No, we didn't show a relationship. But I think it also depends on our own genetics in response to dairy, whether or not we're sensitive to dairy proteins, but also milk these days and a lot of dairy products contain growth hormone if you're not consuming organic products. There's also a high amount of milk sugar, particularly in just straight up milk. And IGF-1 can also be found in dairy products, cow dairy products, and these can contribute to excess sebum and inflammation. So this is something that can be easily determined. If you have a sensitivity to dairy, you can do some food allergy testing and see if you have an IgG sensitivity. And if you do, get it out of your diet and see if the acne gets better. Also, a high-fat diet. Not the good kind of fat, though. The bad fats like fried foods and hydrogenated oils and other things that are generally like bad vegetable oils like corn oil and all of that, that can alter gut microbiota, which can ultimately affect the skin via inflammatory pathways. And a low fiber diet. Low fiber can, it doesn't provide enough food for good bacteria in the gut. So people who don't get enough fiber in their diet, which is a lot of people, you can get an overgrowth of gram-negative bacteria, which results in increased lipopolysaccharide or endotoxin and increased intestinal permeability. So with all of these things, that it's sort of like this sequential effect. It's a cascade of events that occurs, you know, by just perhaps not having enough fiber in your diet and feeding the good bacteria. You have an increased production of gram-negative bacteria and increased intestinal permeability and perhaps dysbiosis. So it just kind of goes on and on and on till you've got some major gut imbalances that are contributing to systemic inflammation. So in terms of dietary recommendations, here's a few things to consider. Obviously, reduce high glycemic foods, get white flour, white sugar, white rice, excess sweets, baked goods, crackers. A lot of this stuff is just filler anyway. You know, if you're going to eat starchy food, pick things that have some nutritional value and have a lower glycemic load. You want to eliminate processed and packaged foods, preservatives, additives, artificial anything. You know, this basically it's not food. So shopping the periphery of the grocery store gives you a good visual overview of where you should be spending most of your time in the grocery store. Do a trial elimination of dairy and see if it has an effect. You know, some people are sensitive to it. It can make a big difference if you get it out of your diet if you're sensitive to it. Unsweetened fermented dairy may be fine. if there's no dairy allergy or sensitivity as determined by some food allergy testing. Otherwise, avoid cow's milk, cheese, and sweetened yogurt and ice cream, all of those things. There's lots of alternatives out there for the things that we like, so it's not really that hard to avoid dairy. You want to avoid unhealthy fats like vegetable oils, corn oil, margarine, shortening, hydrogenated oils, and fried foods. Include healthy fats like fish oils, fatty fish, flax seeds and flaxseed oil, olive oil, avocado, olives, nuts, seeds, and pastured butter. Also include some more high fiber foods. So whole grains, if you're going to get starchy foods, you're better off getting them from whole grains, preferably gluten-free. If you know you have some reactivity to gluten, if you don't know if you have reactivity to gluten, get it out of your diet for 4 to 6 weeks and see how you do. Try to also get high fiber from a lot of vegetables. You know, most people do not consume enough vegetables, and that's kind of the one thing. If you choose one thing to do in your diet, try to double or triple the amount of non-starchy vegetables that you get in a day. And that can make a big difference because it's going to crowd out some of the other food that you shouldn't be eating. Fruits, bran, legumes, nuts, and seeds, these can also be high fiber foods. I think I've said include a wide variety of veggies, eat the rainbow, eat all different kinds of vegetables, learn how to cook them and prepare them, and try some things you haven't tried before. Include some low sugar fruits because they're rich in antioxidants and phytonutrients, so things like berries, kiwis, avocado, melons, and grapefruit. And make sure that you're well hydrated. A good rule of thumb is a ½ ounce of water per pound of body weight. So if you weigh 120 pounds, that would be 60 ounces of water per day. And from a general framing of a good healthy diet, something like the Mediterranean diet where you have moderate protein, healthy fats, and lots of vegetables, lots of plant-based foods. And if bowel function and liver function tends to be sluggish, and this is how we clear hormones through our system, you want to support bowel and liver function through regular detoxification. And there's another lecture that I did for Great Plains. It's located in their archives. It's called Priming Detoxification Pathways for Optimal Health. And that'll give you some good ideas about how to do a healthy bowel and liver detox. All right, so when it comes to addressing digestive function, we have to evaluate the gut with any skin condition. So we want to screen for infections of any kind by doing a comprehensive digestive stool analysis and looking for parasites, bacteria, yeast, fungal infections, anything that we can find that may be disrupting the gut. Also testing for food allergies and sensitivities, so IgE and IgG food panels to determine allergies and sensitivities. Gluten sensitivity, you can just do a trial elimination. There's also serum testing like doing a celiac panel. Screening for dysbiosis. Oftentimes if you do a CDSA, it's going to tell you if there's some dysbiotic bacteria. SIBO testing is usually done through breath testing, but these can also give you a good clue as to the bacterial balance going on in your gut. And also if there's some digestive markers. A CDSA will give you some good digestive markers, like if you're digesting your fats well, if you have a good production of pancreatic enzymes, if you have a good production of bile, which is what helps us to break down our food into its component parts so that we can actually absorb the nutrients from our food. Screening for like an irritable bowel syndrome, often that's related through symptoms that somebody is experiencing, but you know, it often becomes a wastebasket diagnosis because people aren't really testing the gut to see what's there and why the bowel might be irritable. So it's usually related to infections and dysbiosis and SIBO, so you have to do some exploring. Chronic inflammatory bowel disease, Crohn's, ulcerative colitis. Just because somebody has received this diagnosis doesn't mean you can't help them to create some better balance in their gut. I would do all of the above testing and try to create balance and correct dysbiosis and get rid of infections and flood them with some healthy bacteria. So this is just a diagram showing, what happens with gut permeability and inflammatory mediators. In the center we have dysbiosis, and it creates this leaky gut where you get pro-inflammatory mediators like LPS, which get into the general circulation and basically just result in this low level of inflammation, which can manifest on the skin as an inflammatory condition. So when it comes to food allergies and sensitivities, you want to rule this out because it can contribute to gut inflammation and gut dysfunction and dysbiosis and intestinal permeability. And so you really want to rule this out. I think it's an important thing to look at. You can also do an elimination diet where you avoid the most common allergens for 3 to 4 weeks, then reintroduce each food individually to see if there's any kind of symptoms. The most common allergens that we want to get out of our diet, if you're going to do an elimination diet, are wheat, dairy, soy, eggs, fish, shellfish, tree nuts, peanuts. These foods tend to account for about 90% of food allergies or sensitivities. So if you're going to do an elimination diet, get rid of those. And there's a difference between an allergy and a sensitivity when it comes to food allergies. So an allergy triggers the immune system. It's an IgE-mediated reaction, and it can occur within a few minutes to a couple of hours after ingesting the offending food. Your symptoms may be like vomiting, stomach cramps, hives, wheezing, shortness of breath, itchy throat, trouble swallowing, tongue swelling, or anaphylaxis. And you typically see that like when people have a very severe peanut allergy. So this allergy can be very different than a sensitivity. With sensitivities, it doesn't necessarily trigger the immune system. It's IgG mediated, but the symptoms present very differently, and the reactions can occur anywhere from 2 to 48 hours after ingestion of the food. So it's often difficult to link the symptoms of like bloating or a headache or a cough or a runny nose or abdominal pain back to a food that you ate 2 days before. So that's where IgG food testing can come in handy. Common intolerances could be, food allergens like lactose, casein, or caffeine. These, in addition to foods, these are ingredients or parts of foods that somebody actually might be reactive to. So it's important to consider those as well. Other contributors to food sensitivities or intolerances, and these are all things that can contribute to inflammation, are a decrease in digestive enzymes. Somebody may just not have the capacity to digest their food very well. If they've got low hydrochloric acid production in their stomach, maybe they have an H. pylori infection that's affecting their ability to produce hydrochloric acid, or they have pancreatic enzyme insufficiency, or they have bile insufficiency. If they have any of these insufficiencies, they're not going to be breaking down their foods very well, and that can promote inflammation or bacterial overgrowth or SIBO and malabsorption and malnutrition of certain nutrients that may be needed for healthy skin. Sensitivity to certain components in foods like histamines or oxalates, salicylates, food additives and preservatives, all of these things can also create inflammation if you have sensitivity. So the best thing to do is to just do some general food sensitivity testing to see what might come up. And if you still have some reactivity, then exploring these components in food that may be also problematic for you. So the effects of stress, I think it's important to consider stress because, a lack of or increased stress and a lack of sleep can induce the overproduction of cortisol, and cortisol can encourage a production of sebum because there are receptors in the sebocytes for cortisol, so we can get an increased production of sebum. Increased cortisol can also result in increased insulin because cortisol mobilizes stored sugars, and that can also increase insulin as a result of dumping more sugar into your blood. Sebaceous glands have receptors for catecholamines like epinephrine, norepinephrine, and dopamine. And so the binding of these receptors increases the production of sebum and the formation of biofilms and may have a direct effect on the skin microbiome. So it's interesting to note that our skin has receptors for these catecholamines. So when we get stressed, our skin feels it. Skin is the largest neuroendocrine organ of the human body, and many cutaneous hormones and neurohormones can modulate bacterial physiology. Normal skin microbiota can be opportunistic under these circumstances. So if you're really stressed, you may create that environment on your skin that allows for bacteria to overgrow or become opportunistic and cause problems. Psychological stress downregulates epidermal antimicrobial peptide expression, leading to an increased chance of bacterial overgrowth. So stress does affect our skin. We also have something called the gut-brain-skin axis. Stress can change the microbiome of the gut, which can increase intestinal permeability, contributing to systemic and skin inflammation. Inflammation results in oxidative stress, which damages tissues. Early studies revealed that 40% of acne sufferers had hypochlorhydria. Hypochlorhydria is associated with intestinal bacterial overgrowth. So that goes back to what I was talking about before. SIBO, high amounts of gram-negative bacteria that produce lipopolysaccharide or endotoxin contribute to intestinal permeability and increased absorption of LPS, which triggers inflammation. There's a strong association between SIBO and acne rosacea. And so that's different than acne vulgaris, but it is associated with an inflammatory condition of the skin. Systemic inflammation and oxidative stress induces nerve cell secretion of substance P, and substance P is an initiator of inflammation. So when we get stressed, we increase the production of substance P, and that can increase sebum production and inflammation within the skin. All right, so let's get to some topical therapies. We're almost done here. We've got about 5 or 10 more minutes. So when it comes to conventional topical therapies, if any of you out there have dealt with acne, you're going to be familiar with some of these. I'm not going to talk about the use of oral antibiotics or topical or Accutane, because these are products that I think for the most part you'd like to avoid. This is why you're listening to this lecture. So we already know they're out there and they're used for very extreme conditions. The non-antibiotic topicals that are used to help treat acne, usually what these do is help to reduce inflammation, break down biofilm. They can inhibit some bacteria. They increase cell turnover, which is important. That helps to keep the skin clear. They function as an exfoliant, which decreases that hyperkeratinization. So products like salicylic acid, azelaic acid, benzoyl peroxide, and retinoids. So you can see, at least with the first two, these are acidic products. So they do have an effect on pH, so they can lower the pH. So they may also be working by that mechanism, by lowering the pH and also increasing exfoliation. So all of these products can be useful. Even though I'm a naturopath and I know I'm talking about acne, I'm not opposed to using these products to try and get these things under control. There's topical antibiotics. They're often used to decrease bacteria and to decrease inflammation. But again, you can develop resistance to these antibiotics. So with these topical therapies, so salicylic acid, it supports the acid mantle by lowering pH, reduces inflammation, and promotes desquamation. So you're sloughing off skin cells. Azelaic acid is used both in acne vulgaris and acne rosacea. It supports the acid mantle by lowering the pH. It's comedolatic, anti-inflammatory, and promotes desquamation as well. Benzoyl peroxide tends to be a little bit antibacterial. It is available over the counter. It can reduce C. acnes by releasing free oxygen radicals. It's comedolytic, keratinolytic, and reduces inflammation. And then we have the retinoids. And so a combination of these two things can be helpful. Retinoids reduce keratinocyte proliferation. They promote the shedding of dead skin cells, which is one of their best benefits, I think. So it keeps the pores from getting clogged, and it also prevents the development of new lesions. It prevents inflammation, it can reduce scarring, and there's newer formulations out there, you know, so there's tretinoin, adapalene, tazarotene, and triferritine. So the triferritine tends to bind to the skin-specific retinoid receptor. So these products are getting more and more refined. So triferritine is a newer product. It's good for face and trunk, so it could be used on the chest and the back as well. And because it is very specific and only binds to skin-specific retinoid receptors, it can be used in a fairly low dose. I was asked about, there was a question about spironolactone and its use in treating acne. And because it is an androgen receptor, it's an oral medication, and it's basically a diuretic, and it's used off-label as an androgen receptor antagonist because it helps to reduce sebum production. But it cannot be used in males for obvious reasons because it has a systemic effect, and you can't reduce testosterone in males. It may decrease conversion of weaker androgens to the more potent DHT. It's primarily used as a diuretic, and in a recent retrospective study of 110 female patients, 94 saw significant improvement. The side effects were increased urination, low blood pressure, electrolyte imbalances, and lightheadedness because it's a diuretic. The dosage for that is usually 25 to 200 milligrams 1 to 2 times per day. This is often used in conjunction with oral contraceptives in women. The fact that you've seen such an improvement in this particular study, 94 saw significant improvement, tells you that androgen receptors are playing a great role here. So that leads to the next product, which is an androgen receptor inhibitor. This is a new medication, clascoterone 1%. It's a topical medication. It's the first in class of a new topical androgen receptor inhibitor that's going to be available in early 2021. So this is a non-antibiotic topical treatment that employs a new mechanism of action in the treatment of acne. It binds to androgen receptors in hair follicles and sebaceous glands. It restricts sebum production and inflammation caused by androgens. And this can be used by both men and women. So this will be out on the market in 2021. And it's going to go under the commercial name of Winlevi, and it's produced by a drug company, I think out of Germany, called Cassiopeia. And there's an attached article there if you want to take a look at that. So I wanted to mention this because, I know I've talked a lot about pharmaceutical topicals, and because I do believe they have a place. I'm not a fan of the oral antibiotics or Accutane, because the use of oral antibiotics is going to mess up your gut flora, and that is going to have an effect on your skin ultimately. It may initially work, but you're creating imbalances elsewhere to try to treat something on the skin, so that's problematic. So if we can get to acne by using some of these topicals that have very specific mechanisms of action by reducing inflammation, sebum production, and sloughing off of the outer layer of the skin, you can reduce the formation of acne lesions. Now with this new medication that can be used topically, you can block androgen receptors in the skin, which is another trigger for acne. So this could, for people who have a really tough issue or they've been dealing with acne for decades of their life, this could be a game changer for them. So I wanted to introduce that to you. Some natural topical therapies. Aloe vera is good because it lowers the pH, it reduces inflammation and promotes healing. Tea tree oil because it's antibacterial and reduces inflammation. Manuka honey can be antimicrobial. It has to be a very high quality Manuka honey. Activated charcoal can absorb excess sebum because of the drawing action. You don't want to use charcoal or clay too much because you can get a reflexive kind of overproduction of sebum by overly drying out the skin. So you have to be selective about how you use these. I would say a couple times a week is probably adequate. Biocidin, we use this formula to treat SIBO. They do have a liposomal formula that can be used for spot treatment. Or a mask. People can use the throat spray to spray directly on the skin. Keep your eyes closed though, please. It does have some antimicrobial effects when used topically, and it can be used orally to address gut bacterial dysbiosis, and there's the website there. Estrogen, I would only use a topical estrogen cream For women who are older, and don't have estrogen dominance. Now, these products, or this particular product, the one I mentioned here from Rejuvenate Anti-Aging Estriol Face Cream, it's just got some estriol in it at a pretty low dose, and estriol is the lowest potency estrogen, but it can help with aging and acne. So there is a topical product that does have a little bit of estriol in it, which can help. And in terms of supplements, I think it's important to just make sure that nutrition is balanced. So a multivitamin mineral packet, the use of fish oils, I think is helpful. Getting adequate zinc. This may be part of a multivitamin, so you don't have to take extra zinc. Using vitamin A, 10,000 IUs per day. I was asked a question about high dose vitamin A. I'm not a huge fan of that because you have to get upwards of like 300,000 IUs per day to really make a significant difference in acne. So when it comes to vitamin A products, I would be more inclined to recommend the topical products rather than taking really high dose vitamin A. If somebody presents with symptoms of vitamin A deficiency, if they've got celiac disease or pancreatic issues, they've got visual problems, they've got hyperkeratosis, when you get the bumps on the back of your arms, you might be able to increase the dose of vitamin A to maybe 20 to 50,000 IUs per day. But I would look at issues with vitamin A absorption. If somebody is presenting that way, do they not produce enough bile or pancreatic enzymes? Is there some issue with absorption? If they're getting enough in their diet, but they're still presenting with symptoms of deficiency, you want to look at their gut. Niacinamide can reduce inflammation and sebum production. Essential fats, again. Nettles. Nettles is an herb that can inhibit 5-alpha reductase, which is the enzyme that converts testosterone to DHT. So there's products out there, they're usually like prostate products that are for men, but women can use them too if you feel that androgens are an issue contributing to the formation of their acne. Using something like nettles, a combination of nettles and saw palmetto, both of these herbs can inhibit 5-alpha reductase. And again, digestive enzymes to make sure that people are digesting properly, and using ground flax seeds to add a good source of fiber to somebody's diet. So as far as skincare regimens go, there's a lot of products out there, and I'm not going to recommend particular products, but I encourage you to find things that have a mild pH balance cleanser. Do a little investigation on that. Look for oil-free moisturizers. You want to keep the skin hydrated, not oily. For women, look for non-comedogenic makeup. It will usually tell you that it doesn't clog your pores. Doing gentle clay masks 1 to 2 times per week to absorb some of that sebum and reduce the food for the bacteria. Topicals to reduce inflammation, sebum, cell accumulation, and bacteria, all of the things that I had talked about. Conventional is okay. They do work and may need to be used to get things under control. Consider topical probiotic sprays to balance skin microbiome and support normal pH. And of course, diet supplements, fiber, and probiotics are important to all of this. So, although I said I wasn't going to recommend particular products, there's so many products out there that, a lot of them can be very good. And a lot of them, they're just basically promoting a basic product that doesn't really do much. But here's a few recommendations. The reason I wanted to bring these up is just because I'm encouraging people who have skin problems to try to clean their skin every day and take good care of it. And in order to do that, you need to have like a good skincare program that is basically balanced. So of the ones that I have seen and recommended, I think these are some of the better ones. The first one, Larissette or Gunilla of Sweden, she has a very good clay mask that is very thin and works very well. So they've got an acne treatment kit and healing, so it's pretty balanced. Exposure skincare base, they have different programs, different levels. I would avoid the supplements that come with these products because I don't think they're real high quality, but the skincare products are pretty good. So you can give these a choice. They all contain things, botanicals that we know have anti-inflammatory and antibacterial activity, and things that can help to break down the layer of the skin so that it can slough off a little bit so you don't get clogging of the pores. So here's a few recommendations to consider, but you know, there's plenty out there that you can investigate and find or get recommendations from your dermatologist. Okay, that's it. I went about a half an hour longer, but I hope that it was good information. If you have any questions that you would like to have answered, you can submit them to Great Plains and they will forward them on to me and I will get back to you. If you want to reach me directly, there's my email address and that is my website. When it comes to questions on this lecture itself, please send them through Great Plains. Anyway, thanks for listening, everyone. Hope you have a great day.